Go.
Hi, today I'll be showing you a bunch of special tests for the knee, including the anterior drawer, the Lachman test, valgus varus test, patellar apprehension, the brush or swipe test, as well as McMurray's. So let's get right into it. Firstly, I'm going to do an anterior drawer on the patient. So the anterior drawer, you want them sitting on a surface with their knee bent at 90 with their foot dangling off the ground. This test stresses the ACL of the knee and really is only ever done immediately post-injury, as afterwards the hamstrings will compensate to provide, make the test a false negative, meaning you won't get anything that indicates an ACL sprain, even though there is one, because the hamstrings will compensate. So for this test, all you do is, can I touch you first?
Yes.
Okay. All you do, you come down to his knee, you grab behind, put your thumbs on his joint lines. I'm just feeling. You feel a little groove there. And then all you do is, as your thumb's there, you're going to want to just pull forward. Try and pull straight forward. Just relax your leg.
Okay.
Pull straight forward. And while feeling, see if that tibial plateau slides forward. Alrighty.
Is my tibial plateau okay?
I believe so.
There we go.
Next is Lachman's test. So for this one, it also tests the ACL, but it really is more reliable, as it will stop the hamstrings from skewing the test results. So for this one, you have the athlete sort of lay down. If you can, slide back, because you're going to need to bend your knee. You're going to need to bend your knee to like 30 degrees.
Like that. I don't know what 30 degrees looks like, but...
That's a little too much. Here, just slide back a bit more if you can. Try and get your foot on the bed, that way it's easier. So like there. And then for this one, same procedure almost as the anterior drawer, just a different position. The whole idea of this one is to make the hamstrings have a harder time providing that false negative in the test. So by putting the knee at 30 degrees of knee flexion, you really stop them from being able to provide a negative test. So same thing, palpate for the joint line. And then for this one, the one thing you kind of want to make sure you're doing is you got to pull the tibia the right direction, basically straight away from, or perpendicular, like in the same, perpendicular to the tibial plateau. So for here, I'd pull him this way. You don't want to pull this way. You pull him straight, right? So I would just something to be aware of. And then for this, same thing. You just pull forward, feeling the joint line for any sort of movement. Positive test would also be pain with this, and that would indicate a ACL sprain. So pain or movement of the tibia, you'd feel the tibial plateau slide forward and so on. Okay, the next test is I'm going to do our valgus and varus stress tests. So these are for the collateral ligaments of the knee, which is the MCL and the LCL. MCL's on the inside, LCL's on the outside. So for these tests, we're going to be putting the knee into a valgus position, which is a sort of knock-kneed position, which is where the sort of, I'll show you. So you're going to want to try and put them stressed that way and then stress it this way. Sorry, I know my thumb was kind of...
Nah, it's all good. That's just a weird motion.
So firstly, can I show you how to do it?
Yes.
Okay. So for the MCL one, all you're going to do is you're going to grab their leg first straight. They got to be straight for the first time. Just relax it. Just let me do the work. You tuck it in the nook of your arm. Again, feeling for that joint line on the medial side this time. And all you're going to do is you're going to apply a stress, pulling the tibia away from their midline and pushing the femur kind of towards their midline. Sort of trying to rotate the knee, make the knee, instead of going straight, for it to go like this. And basically, you just do it a few times. Just let it chill. And the idea is that this will stress the MCL, and a positive test would be obviously pain with it or gapping in the joint, which you'll feel by palpation.
Do I have any?
No.
Sweet.
So doing this at 0 degrees also tests the joint capsule on the affected side. So in this case, it'd be the medial side. To test pure MCL, you have to bend his leg at 30 degrees. So yeah, that's about right. Again, same thing. Just same procedure, just a different knee flexion. So again, palpating the joint line. Twist. Twist. Do it a few times, see what you feel. A positive would again be gapping or pain.
And do I have any?
I do not believe so.
There we go.
So now for the LCL, it's the same procedure, except instead of trying to pull the tibia out, we're going to try and pull it in towards his midline. So again, I'm just going to do it on the same leg for ease of just simplicity. So again, we're going to start off straight, so just relax. Just relax your leg. There you go. Again, feeling for that joint line. Right there. Yep, that's your LCL right there. You can tell it's a lot more ropey than the MCL.
Yeah.
The MCL is like a big triangle, whereas like the LCL is actually like kind of like a cord.
Yeah, I can see it when I bend my knee.
Ugh.
I think, at least.
Maybe, I don't know. So you kind of want to help it around it. So again, for this, instead of pulling the tibia out, we're going to pull it in and push the thigh out. So for this, well, just some of that, you know?
Uh-huh.
A positive would be gapping or pain. And at straight leg, it also tests the joint capsule on the affected side. So on this side, it would be the lateral. Varus would be test lateral joint capsule, or Varus would test medial joint capsule, sorry. And no, I'm mixing them up again. Valgus tests medial joint capsule, and Varus tests lateral joint capsule. So to get the pure LCL test, we put him again into 30 degrees of knee flexion. This allows us to test the LCL itself in terms of just structure and function. So again, same procedure. So I'm trying to pull the tibia towards the midline, push the thigh away from it to produce that varus stress force. All right? And a positive test would be any gapping or pain. The next test is the patellar apprehension test. Very simple test, so it is used to see if there is a dislocated patella. It's very similar to the apprehension test on the shoulder. Sort of the idea is if it's dislocated, they don't want you to touch it, meaning it's possible it's dislocated. So let's say for this leg is the affected leg. All you're going to do is, hey, I'm just going to feel around here. You just go for it, and if they tell you off, you might want to look for a patellar dislocation.
Okay.
Another test you can do for the knee, it sort of rules out bursitis and so on, is the swipe test. So basically, if there's a lot of swelling around the knee, you're just going to try and move that swelling by swiping it up and around and swiping down on the lateral side as well. So you're kind of just doing that to try and move the swelling around to see if you can look at the joint line. If the joint line is swollen, you have typically it's a positive test. It's looking at swelling in the joint capsule. So all you do is you push swelling on the medial side up, swelling on the lateral side down, and so on.
Okay.
And then I believe the last test I have to do is McMurray's.
Okay.
So McMurray's stresses the menisci of the tibia, which are the two pads of cartilage on the tibial plateau. So for this test, you're going to bring him into knee flexion. You're going to sort of work him through a bunch of different ranges of motion while twisting his tibia.
Wait,
So you
go
can
forward or sideways?
sideways,
Or?
whatever.
Okay.
So all you're going to do,
I hope this is on camera. I can't see. Oh, hi.
so as I'm like working him through this range, you're kind of twisting his tibia in different ways, trying to really grind the meniscus into the structures above it. Basically, a positive test would be any like physical feeling of grinding. And then obviously pain.
Okay.
So you're going to want to do a few times, right? Try different rotations of the tibia in different positions. Sorry, I know it's kind of uncomfortable because I'm grabbing your leg.
It's all good.
I have to move it.
Yeah,
so.
no.
But yeah, basically the idea is you want to grind the tibial plateau, sort of twist it onto the femur, so that to see if there's any grinding or any pain.
All right. Good.
I believe so.
All right.
Yeah, and that's all the knee tests we learned.
All right.